I'm not a doctor as well. I'm just a Rotarian and a passionate community service agent, I would say.
Excellent.
So, do we start now? Yeah. So, good morning, good evening, and good afternoon to all from wherever you are. It takes me immense pleasure to welcome our dignitaries for today. And along with me, we have Rotarian Gomati and Rotarian Raghu Alam, the co-hosts, as you must have already met. And today, our topic today is going to be on mental health. And we've had various sessions in the past, but nothing overpowers this in the importance of well-being and health. So having this focus of mental health today, which has become unprecedentedly the most important thing or the talk all over the world when it comes to stress, anxiety, and mental well-being, it's become critical to manage this across demographies. And so we have today Bob Anthony, who's the chairman for RAGME, that is a Rotary Action Group for mental health initiatives. Along with him, we have Dr. Radhakrishna and Dr. Balamurgan, who are from NIMHANS, as most of you would know, from Bangalore. And they would be sharing with us their insights and recommendations and best practices from around the world. And we were supposed to have a DG, but I am not sure if we have the DG today. A very dynamic person who walks the talk. If he is joining, he would be introduced by Raghu Alam. And well, we would have a short questionnaire at the end. I would request you all to have all your questions typed. We'll have them all addressed as soon as possible after all the three speakers have spoken. So please hold on to your horses and do type in your questions. And even if you have the urge of abruptly interrupting, please do not do so. Thank you very much for your patience.
Rotarian Raghu Alam, would you like to say a few words, please?
Yeah.
Thank you.
Good evening, everyone. And at the outset, I would like to thank RAGCED, Rakesh, and Gomati for having organized this program today. Me, being the director for mental wellness in District 3191, and my team in the mental wellness, over the last 8 to 9 months, we worked along with the NIMHANS. NIMHANS, the full form is National Institute of Mental Health and Neurosciences. It's a very prestigious institute in India. People all over the country come there for any kind of mental issues. So we were very fortunate. Rotary has been very fortunate to tie up with them. And over the last 8 months, our focus was to take this awareness levels to the schools, especially the grade 8, 9, and 10 class students, to the teachers and to the parents, and to some extent to the public society. So I would say that we had so far covered more than 6,000 students across 25 to 26 institutions. We have covered, created awareness to more than 750 teachers, 200 plus parents, and many more public, adults in the housing societies. So the journey so far has been very good. I mean, there was, a lot of appreciation at the end of every session. There's been appreciation from the teachers, from the principals, that they did not know that their own students were going through some mental issues. Even at grade 7, we felt there were students were having mental issues. It could be family, it could be environment, it could be financial, so it could be school itself. But then it was a good journey. Today's main thing, our focus is just to once again say what Rakesh had just said, is that to understand the best practices that has been followed by us in India through NIMANS, and also understand from Bob, the best practices that they follow in US and across the world, and see how we could implement the best ideas in our further programs in the coming years. So that is the idea of this today's program. And I would request once again the people who have questions to wait till the speakers finish their talk and then raise the questions for further interactions. Thank you.
Rakesh, you want to?
Well,
So,
then, thank you. Sorry.
Take it forward, yeah.
Yeah. Thank you very much, Rotel and Raghu. So I now pass it on to Gomati to introduce Bob Anthony, the chair for RAGME. And soon after that, we would have Dr. Radhakrishna and Dr. Balmurugan speak. Thank you very much.
Okay, so Bob Anthony was the chairperson for the Mental Health Initiatives Rotary Action Group for Rotary International. RI is instrumental in making the eradication of polio practically by its local presence in the form of Rotary clubs in 200 countries. This action group helps those clubs break the stigma, raise awareness, and increase access for early treatment and prevention of behavioral health challenges. He has facilitated implementation of behavioral health projects in the USA, India, and Nigeria. He is also the executive director of Adolescent Wellness, Inc., AWI, a 501c3 nonprofit. He founded in 2005 after a 20-year career in the tech sector. AWI promotes development of practical resources to prevent mood disorders and prompt earlier treatment. He moved to Naples, Florida from Boston in 2019 with his wife, Nancy. They have 2 sons and 2 grandchildren. Over to you, Bob.
Well, thank you so much, Gomati. I am honored to be invited to speak today, and I am also honored to have acquired so much positive news. Typically, in years past, this was a talk about stigma and awareness. This year, in particular, we're talking a great deal about solutions, things every single club can do to improve wellness within their club, wellness within their community. I've had the personal pleasure of visiting Hubli for a program, and more recently visiting, Hubli was a couple of years ago. I'm looking forward to visiting with Rita Agarwal in District 3030. She has been amazing, and I finally read the most recent copy of the Rotary magazine. Several India dignitaries are prominent in here, but Rita Agarwal was named a champion in this month's issue for her success using one of the Rotary toolkits called Wellness in a Box. If you've not yet looked at the website, which is ragonmentalhealth.org, I encourage you to do that. There are half a dozen toolkits for any club, any champion really, to implement. And there are also, there's a map within the chapters menu, and you'll see that India has more district chapters of the mental health Rotary Action Group than other countries, certainly most other continents. So you're doing great work already. I've seen the most impactful project be in ending the delay in treatment between first symptom and first treatment. I've got some slides that make that a little more obvious. It's a bundle of resources for the patient. So the same day a child is diagnosed, treatment can begin. And it's through patient education that's documented, evidence-based, that can be handed to a child as young as 6. And if there's an active parent, there's a separate toolkit with the same content. But you'll hear more about that in a moment. I just wanted to celebrate what we've done in the past month. So the program we call The Lever is being implemented by these pediatric providers in my town of Naples, Florida. And the Rotary Club Harborside in St. Croix heard about it and is now replicating the program on their island. So that's why we've got Island Pediatrics listed and Dr. Thornburg listed. The program here in Naples, Florida, which is District 6960, is actually part of a global grant project that was sponsored by Rotary District 3030 around Nagport. So we are the beneficiaries here in Naples, Florida, in the USA of this remarkable grant, and now have the majority of our pediatricians directly managing all cases of anxiety, depression, ADHD. In the statewide statistics, it's less than 1 of 4 pediatricians treat these ailments because they don't have the time. These new resources allow that time for treatment to begin. As you can imagine, early treatment's really important. Mood disorders and most mental illnesses are diseases of the youth. If you ever are to have depression in your lifetime, you'll have symptoms by age 14. If you ever have anxiety in your lifetime, you'll have symptoms by age 14. And the same is true for ADHD. The bad news, and the thing that Rotary's focused here, is less than half of people with symptoms receive treatment in their lifetime. And untreated anxiety, ADHD, depression impacts morbidity as well as mortality.
Bob, could you just increase your volume?
Of course, yes.
Yeah.
Is that better?
Yes.
So when I speak about pediatricians, I'm speaking about all pediatric providers, people who prescribe medication. So in this country, the licensing groups are for a physician, that would be a traditional doctor, family doctor, pediatrician, a physician. We also have physician assistants who have the right to prescribe medication. And we have nurse practitioners who have the right to issue prescriptions. And this is very important because we start holistically through these toolkits, but some ailments don't respond well to talk therapy or to exercises. ADHD is the obvious one. It can be managed very well, especially if you start managing it as a younger person. But there's a very quick impact if a prescription is required. These numbers are important. I said the doctors don't have time. Well, they don't have time because in the US, they treat more than 1,000 patients annually. The average is actually closer to 1,500. That translates into about 7 minutes per patient during the workday. So screening can be done, and most doctors here screen, but most doctors here don't treat. They merely identify you have a problem and hand you a phone list and encourage you to get help elsewhere. So they don't have time for lengthy discussions on the topic to explain it to the parent, to explain it to the patient. And as a result, this is just 1 in 4 of the doctors actually treat. They cite training, time, confidence, reimbursement as the reasons they don't, time being the primary gate. So the breakthrough is that all providers, all prescribers can now hand over this holistic tool, the guided self-management toolkits for families as indicated by a screen. So there is a toolkit on the topic of anxiety written in a format suitable for a 6-year-old to work on their own. The same content is provided for the parent to understand and coach effectively. The same material is again published in a format suitable for a teenager. And that's repeated for depression ×3 formats, ADHD ×3 formats. And there's a 10th toolkit out there that is identifying what we call disruptive behavior disorder, and that's suitable for a child down to age 3 to interpret with the help of a parent.
One of the most challenging things about being a parent is just finding the balance. I have 5 daughters. They're all different. What might work for one might not work for the other. It's just hard. My kids have a big trauma in their life. My child's father passed away. When she was little, a teacher told us, she doesn't look at us in the eyes. She wouldn't sit still. In kindergarten, she couldn't pay attention. So we did see some things in Gianna, just like we saw in Micaela, but a lot more came out once their dad passed away. It just became even more difficult.
I had a really hard time with math. The way they explained things to me was really confusing, and I just couldn't understand anything. Reading was a struggle, and I couldn't read any of the packets or anything of the instructions. So it was really hard to read and write. My anxiety was really bad, and I had panic attacks multiple times a day, every single day. That was probably the hardest point in my life. It just felt like everything was crumbling in on me. It's hard. It's very hard. I felt like I was drowning, but even worse, she felt like she was drowning. And I didn't know how to get her out of there. So I came to my doctor's office to ask for help. I met with Dr. Anzalone and Dr. Tam. And then I was introduced to a toolkit.
One of the things that we focus on in our clinic is teaching basic coping skills. And one of the very helpful resources has been using the toolkits from Boston Children's Hospital. They teach small evidence-based ways to reduce anxiety, reduce depression, and manage behavior in general. And through teaching those skills, one, you can help individuals with all levels of severity, and it also keeps people from having unnecessary treatment, time, and costs.
To have it organized in a way that you can actually focus on each child's issue and have an ability to be able to manage each child personally and in a way that it's going to be meaningful for that child's issue is going to help her, because it can be overwhelming. But when we can give people the ability to organize it in a way that makes their lives easier and bless their children in a way that they can heal, empowers her.
When I read it, it just all clicked. It's kind of like, wow, I'm not the only one that's going through this. I'm not crazy. My kids aren't crazy. There's people that understand and other people that are going through the same things that I'm going through. So it helped me.
It's amazing, honestly, what these toolkits can do. If you just read some of the information, it makes a lot of sense. It felt great. It made me feel better. I'm definitely doing a lot better these days than I was before. It was great.
Today, the girls are doing good. They're much better. Every day we're still working on stuff, but much, much better. The girls have improved a lot. if you're a parent wrestling with this, I've been in your shoes. Read it, give it a try, and it works.
I had mentioned this manual and they talk about it more eloquently in the video. The work that Rotary does is to introduce hard copy of all these digital resources to the local doctor. There are lots of opportunities for doctors to take training for continuing medical education. So it was hard to distinguish that this has a new element. The toolkits are the new element. So the Rotary Club of Naples and others in the district physically printed and bound these 10 digital toolkits and brought them to the local doctor's offices to say, this comes with the bundle of training. And that was the light bulb effect. That's when they said, this is different. We want to do this. And so that's been the impact of the Rotary, is to A, print and publish these, and B, bring them to the healthcare providers to see them adopt the program quickly. So we, as a result, now have the majority of pediatric providers directly managing all mild and moderate cases in our county, Collier County. That's the first county in Florida to achieve this. So we've gone from 1 in 4 to well past 2 in 4. This is a survey result from the providers directly. And before taking the self-paced training, which is web-based, their knowledge on these topics was right at 50%. Following a 5-hour continuing medical education, it jumped to 98%. Their confidence level in correctly diagnosing, correctly treating was 41%, and that jumped to 99% as a result of this program that was introduced by the local Rotary Club. The most important statistic on this chart is their intention to treat. So following this resource becoming available to them, the pediatric providers declared they were intended to treat 94% of them. So we're very proud of that. That was the clear win. So I'm not going to show that video. It's a little more technical. It's designed for the doctors. It's available on the website, that ragonmentalhealth.org website, and you can view it directly. But I prefer to reserve the 3 to 4 minutes it runs to talk about what you can do, what we've done here. The toolkit has a short link, bit.ly/BBOU for Building Bridges of Understanding. And that downloads a summary of this whole program that we want every club to consider bringing to every community. I thank you for your time.
Thank you very much, Bob. It was a wonderful presentation and very insightful. I now welcome Dr. Radhakrishna from NIMANS to speak up. So you would have 20 minutes. And to give a brief introduction about Dr. Radhakrishna, I must tell you that he is a person who has written multiple journals and has been doing a lot of research in mental health. So please do speak about it, sir. Thank you very much.
Sir, unmute, sir.
Good morning, Dr. Bob. And it's an impressive work what you are doing there at US. Insightful. And of course, I'm Radhakrishnan. I'm an additional professor in the Department of Nursing attached to child and adolescent mental health and community mental health care. I'm privileged to be a part of these two units for the past 10 years. And it's almost great learning to be with the most needed and vulnerable population in the community. And of course, all of us are aware that the mental health care gap in India is huge because of two reasons. One, the awareness about mental health and mental health care is limited in the community. Number two, stigma still prevails even among the educated community. So stigma prevents them to seek treatment. So what we have envisaged is, if someone do not seek treatment or care, we need to reach them. That's the main objective of our community mental health approach. So what we have done, I'll be talking about a couple of projects, what we do, and then our affiliations, and then we will try to mention about the Telemanas program, which is recently launched. So what we thought, if they don't approach, we need to approach. So that is the reason we started with a project called Care at Doorstep for Psychiatric Disorders by Community Volunteers. The mental health workforce, be it psychiatrists, psychiatric nurses, or psychologists and social workers, in India is considerably very, very low. If we start producing all these professionals for today's need, I think we need to prepare for another 20 years to meet the today's demand. So what happens, this makes us imperative and essential to train all the health professionals, paramedical workers, and community health workers, volunteers for this cause. So we started working on it, and it yielded results. And we also felt that by sensitizing the local community, especially the volunteers, so they try to help streamlining the number of individuals who are suffering in the community and do not take treatment, number one. Number two, there are some individuals who have taken treatment, but in between dropped. So they need to be streamlined again, at least with our district mental health program. Of course, this is a flagship program in Government of India. All of us know that Government of India has launched district mental health program way back. But still, there is a huge treatment gap. So that is the reason we start off with the thought of doing this. So far, we have trained around 3,000 volunteers of various categories. And these volunteers, mainly what they do, they educate public. That brings mental health awareness. It reduces stigma. Like any other disorders or any other problem, when they seek doctor, they don't have the stigma. But when it comes to mental health, there is stigma. So that is, we tried reducing that through this effort. In fact, in the process, we learned that youngsters, especially youth, need to be targeted. And then we started creating a project with the help of Rotary Club, thanks to the Rotary administration at Bangalore, especially Mr. Raghu Allam and his team. And we were very pleased to note that Rotary Club has started the mental health initiative and drive. And then we partnered with them. They were very graceful in supporting this cause. This project esteem called Educating the Teachers for Mental Health of the Children. In fact, whenever we target children and family, it is going to be very limited in number. But whenever we teach teachers or educate teachers, the effect is manifold. It's like like a nuclear fission, where a teacher who deals at least number of children in terms of teacher-student ratio, the number is very huge. So we thought of targeting the teachers, bringing them the awareness, problems faced by the children in school and at home. So this has really resulted in kind of good response. Then through them targeting the parents, the needed parents can approach us, and we psychoeducate them, we talk to them, and then children who are in need or identified, basic screening tools are applied, then they are referred to the healthcare system, mental health care system. So, of course, we have conducted more than 27 schools and 383 teachers were catered to, and addressing more than 3,722 students and 165 parents. Of course, this is a very big challenge when it comes to the numbers, but we wanted to make this as a project so that we can cover initially the Bangalore district, then move into the Bangalore rural districts, then cover slowly the other district too. So this is a humble effort. With the help of Rotary Club, we started doing that. And of course, as I mentioned earlier, the Child and Adolescent Psychiatry at NIMHANS is very cooperative. In fact, Dr. John Vijay Sagar, the head of the department from that discipline, has assured all the support. Dr. Rajendran, both of them are very committed for the community mental health care of children. And this is a multidisciplinary team. We have psychologists, social workers with us. And what we found is the nurses is a one community which is omnipresent. For example, you go to any taluk, you go to any district, you go to any sub health centers, you will find a nurse who is registered and then who is working there. If you put it in population ratio, somewhere between 2,000 to 5,000 population, they are covering in the community. So we felt that educating the nurses who are in the community, they are not psychiatric nurses, but they are nurses. And their training involves in comprehensive care of people with mental illness. So we felt that that is a target group we should be approaching, and we started training them. We had one PhD thesis training the nurses at Ramnagara district, Bangalore. And we also had one more thesis, early developmental delays and disorders must be identified. In fact, Dr. Bob mentioned the reason why we need to attend to their problems at the earliest. Early the screening, early the treatment, early the identification, early the education of the parents happens. So we felt that that community need to be targeted. And again, one of our PhD scholar, Dr. Rajalakshmi, have completed that. And now we are focusing on educating the parent. So that project is going on through one of the PhD thesis, educating the parents on mental illness of, care of children with mental illness through parents. Because ultimately, a child is admitted in a hospital for about 2 to 3 weeks. And then they go back to community. So how to take care of them in the community, in the family? So that is the thesis that's happening. And the response is good. That we are doing it through a clinic called Nurture Clinic. This Nurture Clinic targets need-based interactions and interventions for children with mental illness, encompassing the family approach. So that is happening for the past 3 years now. In fact, the nurture clinic can be replicable, is a replicable model. I can share maybe those publications. We have 4 or 5 publications related to child and adolescent mental health care. Maybe I can share it in the due course. And the current facility what we have is around a 40-bedded child psychiatric center and a 24-bedded adolescent psychiatric center. Of course, this is unique in the country. We have the child psychiatric and adolescent psychiatric center. Earlier it is called a child guidance clinic, and then was part of Department of Psychiatry. Then it became an independent department 12 years back, and now the outreach is much better. In fact, we 3 or 4 faculty takes this child adolescent psychiatry to the community. The reason is, whatever you do at this big center, ultimately we cater to 1 or 2% of the people who are suffering in the community. So we thought that this must reach beyond the hospital. So the work is going on, and thanks to the efforts of Rotary, they are really helping us in terms of logistics and organizing the programs, etc. And of course, as I mentioned earlier, our center has these many services, and of course, even including emergency child and adolescent psychiatric services also added newly. And there are many more school-related programs are done. Suicide prevention programs are conducted, and of course, preventive promotive services, I am a part of it. And as I mentioned earlier, when they don't seek treatment, we need to reach them. One initiative is Telemanas, which is a Government of India's flagship program, spearheaded by NIMHANS. I request Dr. Balamurugan to briefly address about this program, where how teachers, parents, and children can benefit from this Telemanas projects. Dr. Balamurugan, are you there?
Yes, sir.
Yeah, please.
Yeah. Thank you, sir. Thank you, Mr. Bob, for sharing your toolkit information, I think, which will be more beneficial in saving the time of healthcare professionals in treating actually treatment to the needed patients and parents, actually. As we discussed earlier, and as both the speakers said, in mental health, stigma plays a major role in seeking help, whether they are educated or not educated, or they are wealthier or poorer, and whatever may be the spectrum in the society, everybody or most of them are having a stigma towards this mental illness. Even though they are having some kind of sickness, they don't want to seek help because it was highly stigmatized. So because of these reasons, the treatment gap in mental illness is very huge, actually. So what the Government of India planned a couple of years back is try to reach the unreached people through the use of technology. So that's the reason the Government of India launched a program called Telemanas. So it was launched in October 10th of 2022. The Manas stands for Tele Mental Health Assistance and Networking Across States. So our aim is we have to reach the unreached people in Indian country, whoever having a device of any kind of phones. So through phone, at least they can get minimum mental service, which can be delivered through phone. So basically, it is a toll-free telephone service. The number is 14416. So it's a 5-digit number. It's a hotline, toll-free 14416. This number works 24/7, 365 days. And right now, we have like this 51 state Telemanas cells across India. So depends upon the populations, the number of cells are established. So state governments establish these cells. And these 51 state Telemanas cells are mentored by 23 mentoring institutes. These are all the Institute of National Importance institutes. So we have AIIMS, is an All India Institute of Medical Science. So it's one of the national important institutes. Like these 23 institutions are identified, and these institutions will mentor these 51 cells. Whereas these 51 cells and 23 institutions are regionally coordinated by 5 regional center of excellence, regional coordinating centers, and the entire setup is coordinated, monitored, and evaluated by NAMANS, that is National Apex Coordinating Center. So this is the way the entire setup is established. Now we have entire setup is functional. So through this, what happens if a person, sir, next slide, sir, please. Yes. So just I briefly explain how the telemanas works. If any person calls to this number, so that person will be connected to a counselor through an IVRS system. So the counselors are recruited by state governments and they were trained and accredited by NAMANS to provide basic mental health services. So what we believe, around 80% of the callers who are interested, they can be managed by these trained accredited counselors. However, and 10 to 15% needs additional mental health professional support. So this telemedicine as a provision have an in-house mental professionals, which means telemedicine state cell has counselors as a tier 1A level. Then they are supported by mental professionals. The professionals includes a clinical psychologist, psychiatric social work, psychiatrist, and a psychiatric nurse, which means a counselor feels while providing basic counseling to a caller, if the counselor feels the caller needs some kind of mental support, immediately the call can be escalated to the fourth stage where a mental
Yeah, I think
I
Dr.
think we
Balamurugan.
lost him.
Yeah. Of course, this project, I'm also a principal investigator. So once this call reaches to the second level healthcare providers, especially the doctors, and they will be able to identify and even provide prescriptions. That is facilitated through the e-Sanjeevani applications or platform. In fact, now e-Sanjeevani, all of you know that it is currently working well for physical health issues. e-Sanjeevani platform is very well accepted by the public. They need not to travel all the way for seeking help. They can log in through the e-Sanjeevani app, consult a doctor, get e-prescription, and that is very valid to get the medications at the local and take care. So similarly, this is going to be linked with e-Sanjeevani shortly, where face-to-face consultations can happen. Now it's only a telephone call, as Dr. Balamurugan was mentioning. So e-Sanjeevani is going to be a comprehensive program. And of course, all of you know that the digitalization of health records are happening in India through an ABA application. So a person can choose to authorize what kind of document should be shared with my doctor, so that with that Aadhaar card and also with my ABA card, I can selectively, I need not to travel with my file. Suppose today I'm here, I'm going to Delhi, and at Delhi I want some consultation. So there the e-records, medical records can be transferred with my authorization, so that the doctor knows what is my past history, etc. Similarly, e-Sanjeevani is going to take over, the platform is going to take over the entire consultation process. And of course, all of you know that everybody cannot avail this system. Those who are able to reach, they can reach. And of course, this is one aspect. And it can also serve as a telemedicine platform where a doctor from the primary health center, a nurse from the sub health center, or suppose a volunteer, medical professional, but he is a volunteer, not a psychiatrist, can access to this number, approach the telemanas program, and provide the necessary mental health first aid or mental health education with the help of this application. So this is something bit comprehensive. See, the individual can approach, the family can approach, teachers can approach, volunteers can approach, and the healthcare professionals can approach, So it provides for everybody to seek for treatment and help the client who is in need. So that is how it works. And of course, maybe we will see whether Dr. Balamurugan is able to join. If not,
Yes, sir. So,
yeah,
so
yeah.
sorry for inconvenience. There's some network issues here.
Yeah.
Thank you, sir, taking a lead. So, as sir mentioned that if anybody calls this number, at any cost, there will be a service provision of minimum mental health care at the counselor's level or a mental professionals level or even to an inpatient care where the district mental program team will be connected with this. So that's our whole ambitious objective, I can say. Whoever are in distress, please make a call to this number. At least a minimum mental health service will be delivered at any time, 24/7, 365 days. And just I mentioned this call rates here. This is 2 days before it was around 8.97 lakhs. As on today, we received around 9 lakh plus calls. So within this 1.5 years, we received 9 lakh plus calls. We supported the provided services to these individuals. And with this, I would like to conclude this telemonus component. And over to you, Radhakrishnan, sir. Thank you.
Yeah,
Sir.
thank you, Dr. Balamurugan. Now, of course, Dr. Rakesh Babuji, I think we have just exceeded the time for 1 or 2 minutes. Maybe we can just, I'll withdraw the slide now. From here, we would be happy to collaborate with Dr. Bob. Dr. Bob, we are very pleased with your work. And there are many similarities of the work, what is happening here and there at your place. We would love to have a collaboration with you. Thank you.
Well, thank you so very much. That's high praise. And I must say, I'm not Dr. Bob. I came from the accounting world and got involved with mental health through a personal experience. And it's now a passion as it is with all of you. I'm thrilled to say that we have a toe print already with this program in India via District 3030. Your Rita Agarwal is currently thinking about how to propose it, and it could easily be a multi-district proposal. So yes, let's collaborate and let's build on Rita Agarwal in District 3030 to expand this quickly.
Thank you very much, doctors, and thank you very much, Bob. It's I mean, one of the I would say the benefits of having these kind of sessions is to build collaboration, and this was exactly the best illustration that we could see. So it's amazing to know the kind of development and the kind of research that all of you have put in to this subject, especially Dr. Radhakrishnan and Dr. Balamurugan. You seem to be, I would say, full on into the kind of work you all have been doing, and this, and I also heard that this is a national initiative, and you have been a part of the team and have been leading this for a very long time. And these are the results of all this. And Bob, it's amazing to see what you have done and the kind of progress you've made over the years, and the kind of results you've brought out of those research that you've kind of put in. So it's amazing. So now we come to the last bit of this whole session, where all of you can ask questions, and if please do limit your questions, 2 questions. Let the suggestions and recommendations come from the doctors and Bob, the expert. And we would love to hear your experiences, but I would request you all, for the consideration of time and the limit that we have, to write to us. And we'd love to have these things published if they're really good and known to all. So we'll do the sharing part, so don't worry about it. For now, let's focus only on the questions. So The floor is open for all.